I get asked all the time what maternal fetal medicine is. And the long answer is that it's a subspecialty of obstetrics and gynecology dealing with high-risk pregnancies, dealing with prenatal diagnosis and genetics. And what I've over the years have come to tell people is that basically what I do is I take care of the baby before the baby's born. My career didn't start in medicine. When I graduated from college, I actually worked in South Texas as a geophysicist exploring for uranium in the late 70s. It was only after a very good friend of mine who was in medical school at the time enticed me to try to go to medical school. He had a purpose. He combined the art of science with taking care of people, and that was exactly what I felt like I wanted to do with my career. I then applied and was accepted to medical school at the University Medical Center. After that, I attended the University of Arkansas Health Science Center and did a rotational internship. And the reason for that is I was uncertain as to what specialty I wanted to enter. During that period of time, I was required to do a rotation on the obstetrical service, and that's when I fell in love with obstetrics. At that point, I did a residency in OBGYN at the University Medical Center, stayed on and completed a fellowship in maternal fetal medicine. For the most part, all my patients are referred to me from their obstetrician. And reasons vary, but the majority of patients are at risk for complications of their pregnancy, whether it be from their age or their ethnicity or a family history. Well, a recent example of what I had, or a case that I had in which I was able to make a big impact on the outcome, was a patient that presented to me whose baby had severe anemia. And we were able to literally give the baby a transfusion inside the mom and save the baby's life. She was able to carry the pregnancy on to term and had a uneventful outcome afterwards. My philosophy for patient care really encompasses open communication. It is important for me to listen to my patients. Pregnancy is a time of excitement, but it also can be a time of anxiety. And if I can listen to what the patient's concerns and needs are, then I can treat them much better. At the same time, it's important for me to communicate to the patient in an open, honest manner and give them information about the well-being of their child, and do this in a fashion that they can understand. As a husband and father, I feel that I can have an understanding and sympathize with my pregnant patients. And my goal is for them to have the best possible outcome.